appropriate parties are reviewing the spec sheets and the literature on the products. Most notably, we would pull in our infection prevention team. We would pull in environmental health and safety. EVS leadership would look at it. And we would basically go over all the information to ensure that we're not going to be foreseeing any problems. The second step is, we definitely want to introduce it. In this case, because this is a secondary step, we're going to kind of introduce this in phases. So it's not like we're handing sprayers out to every environmental services technician and saying, okay, just have at it. We're going to pick some areas where we're going to strategically use it, and we'll ensure that they're trained and in-serviced on the product, and we monitor the usage and get feedback from the staff on things that we could tweak or make better. Case in point,
Jeff.
For this,
Jeff.
Yes. Ask me.
Yeah, I just want to interject what you mentioned before, which I know you're going down this path, and also what Dr. Carr and what Dion just mentioned about notifying the patient. One of the things that's interesting is the electrostatic sprayers. And now there's starting to be other manufacturers coming into the market that are making all different kinds of electrostatic sprayers. It used to be only one or two. It's starting to spread out to other manufacturers. But what's interesting is when you see a housekeeper walking into your room and he's holding a gun as opposed to a mop or a microfiber mop, he's holding a green gun or a backpack sprayer, the first thing that comes out of the patient is, or usually of the patient or the relative of the patient, what are you doing? What's going on here? And that starts a discussion. And that discussion itself, I think, is very powerful because, first of all, a discussion is what bonds people together. So immediately it creates a bond between the patient and the housekeeper or the supervisor and the patient. And then you can start the discussion like, well, we're using HOCl, and you can start breaking down what it is that you're planning on doing. And
correct.
From Dr. Carr's perspective, it's a one-stop shop kind of application because the product itself asks the question. Sometimes you want to use something that's going to create the question so that you can create the dialogue. And that sort of makes the patient feel better and also makes the patient think that your guys are using the state-of-the-art, safe product that's not going to hurt them or the people that are visiting them. But that in itself, I think, is a powerful statement, just what you mentioned.
Yeah, no, that's an excellent point, and making sure that the staff are well educated to speak on the product is key as well.
Right.
They don't necessarily have to walk into the room with the gun, but one of the things we considered about some of these sprayers was that the optics of the situation, and during the pandemic, where as our numbers were rising, and you're hearing all these stories come out from other countries and other cities, and I know one of the things that really stuck out to me as I'm watching the news, and really I'm going to try not to watch as much news now because I got depressing at one point, but you're seeing a lot of the countries where you're seeing people walking the streets with foggers and they're spraying everything, and so I think that the visual of staff using sprayers was really profound. And so if they see our staff doing it as well, they're probably saying, hey, they're using something similar, that must mean they're really taking it seriously. But to Alex's point, you want to explain the product. You want to explain that it is very safe, that it's really a green product. It's made from water, salt, and electricity. You can't get any more simpler than that. And be able to explain about how it can kill germs but keep them safe. So great points, Alex.
And also, Jeff, to go on what you were just saying also is when you do create a question, in other words, when the patient is going to ask the housekeeper, what are you doing? Like, what is that? That in itself forces the housekeeper to become educated, and the housekeeper himself will start feeling very proud of what he's doing because now he's the professor. He's there to educate the patient on what exactly is that he's doing, and so he becomes the expert. He becomes a technician. So it's a double win. It's a win for the hospital. It's a win for the patient and the housekeeper because both are becoming educated. Both are feeling empowered, with the information and feeling secure with the information. So it's really a win-win across the board.
Absolutely.
Well, Dion, Jeff, Alex, and Liz, one of the things I wanted to point out, because I'm not sure if Jeff and Alex know my background. My background is in public health. And one of the concerns that I have, and I'm speaking from a lot of the information that I gathered from doing research in the public health area, you all know how safe it is. But from the patient perspective, a lot of time, as a stakeholder, not every patient that comes into the hospital has that security or that sense of confidence in healthcare. Mm-hmm. So I don't think that walking into the room and then explaining may be a time. I think you should be the person to kind of start the conversation. Don't let them see the gun before you walk in, because sometimes there's a sense of not trusting healthcare. For instance, a lot of people did not believe in the COVID-19 virus. The relationship is not always that great. Not because a lot of people, as we all know, many people come to the hospital when everything is falling apart. And that's because a lot of times they don't trust that the people that is supposed to be taking care of them will take care of them. It's not 100%.
That's an excellent point.
Yeah,
that's a great point, because we heard stories of that I think that message early on was very clear. Oh, this is a hoax, and it wasn't a hoax. And any of us working in New York City saw that firsthand. And actually, that hearing that that was offensive to me, because like, if you saw what I saw, you would know this is not a hoax. But more importantly, that narrative changed to just the sight of somebody in scrubs in some places. Oh, we're going to treat this person poorly now. And they're a healthcare professional trying to do their job and trying to take care of others, and they didn't deserve to be treated that way. So I think those are excellent points, Dr. Carr.
Well, just to piggyback off of what you were saying, because I'm like in the middle, like I'm the middleman in between health facilities and also the lay audience, which are the patients. I know that there's a dialogue that is not occurring. That's why there's a lack of a total understanding. You're there to do your job, but because of experiences in the past, like the Tuskegee experiment, a lot of minority populations come into health facilities and don't trust that they're going to get the same proper health care as the white population. And so there is a certain group that may not believe that what you have in that spray gun is actually healthy. So it's already a scary experience coming into the hospital. So it's very important that we engage in that dialogue. And that's why I kind of suggested putting information up, having these discussions prior to walking into the room with those guns. And still after you explain it, still maybe some people may not trust. But if you are the person who engaged in that dialogue, it might bring a more sense of confidence and belief that what you're doing is not going to harm me as a patient.
So maybe we may come up with signs. I know in different hospitals that I worked, when we treated rooms, we would treat an empty room and put a sign up. So when patients are passing, if they have a question, we would be glad to answer their questions when it comes to the products that we're using. Because as you said, Dr. Carr, a lot of patients will not want you to come in and spray their rooms while they're there. They definitely don't want that. But
good points.
When you're in the room, treating the room, especially, they want to make sure that the room is properly clean before they got in there. So when they're seeing all of these extra steps, oh, what is that? From my experience, more curiosity is there for them for us to explain it to them, and they're so relieved after the explanation is given. So
Dion, though,
Huh?
Yeah, but I just wanted to see, one of the interesting things is that a patient is in the room all day and he has nothing to do but to sit around and look at the ceiling, the floors, the walls, and that's pretty much what they're seeing if they're conscious. And so if I know again with my family members having just gone through this, I remember my father saying to me, housekeeping wasn't here in 2 hours, and it wasn't any of the hospitals you guys work in, but you say housekeeping wasn't here in 2 hours. I go, Dad, they don't need to clean the house, the room every 2 hours. Patients today with COVID I think has changed the way patients are thinking of things. I know my father was that way. And the scary thing is patients today, especially with COVID, they don't get to see their relatives. Their relatives are not allowed in. So the only person that they have a relationship with is the doctors, the nurses, and housekeeping.
Correct.
And they're trying to trust these people and hoping that they're doing the best job. And they feel very vulnerable because their relatives are not around to take care of them, to make sure that things are going well. So he would call me, go, Alex, housekeeping is not here. Where's housekeeping? I go, Dad, the germs are not going to pop out every 2 hours. They mop the room, they clean the room. If no one is, coming into the room right now, you're okay. It doesn't. So in a way, you're right, Dr. Carr. You hit it, out of the ballpark with that importance of letting them know first. But at the same time, the patients today want to make sure, especially with COVID, that those rooms are being disinfected. That's their number one priority. Am I going to get COVID? Or if I have COVID already, am I going to get something else? These are things that are going on in their heads, and they want to feel reassured that whatever it is that's being done in their room, it's being done for their safety from getting infections.
And they also want to make sure that the product is also safe.
Safe, absolutely.
Correct. 100%. 100%.
Your father's story is so profound, and I think that we need to take this message back to our teams. Every EVS leader should, and we need to have discussions now more than ever. It's extremely important for both infection control and for us to communicate to our patients. So we are out of time. Any final thoughts on anyone's mind, really quickly?
I have a final thought. Just some of the things that I look around for when I'm in the hospital or if I'm going for my annual checkup. I look at the television overhead and I listen to the new updated information. So those are some places maybe we can put information about the new products on bulletin boards. I am very observant and I believe Alex said, we look at the walls and we look around during that time that we're waiting. So I think that will be a great place to pre-introduce to the introduction from housekeeping. Great
thought. So Dr. Carr, Jeff, Alex, this has been a really great conversation. Join us next week when we talk about lessons learned from the pandemic, key takeaways, and how EVS needs to start thinking out of the box to be prepared for another outbreak or pandemic in the future. Thank you, everybody. It was great speaking and learning more about alternative disinfection methods and sharing and hearing some patient stories.
So thank you for joining Clean and
Thank you. Thank you, Gary.
Thank you.
Bye-bye.
Thanks.
Bye-bye.
Bye-bye.